Out of this Valentine toxin is very important, doctor. It can cause lung infections and necrotic skin. Now, it does not produce any erythrogenic toxin. All the remaining things are basically produced. Then what is this coagulase negative staphylococci, doctor? Staph epidermidis is called coagulase negative. Typically it produces a lot of slime overlying it, and that is the reason there is a lot of resistance for the phagocytes to capture this fellow, that is the coagulase negative staphylococci, is what need to be remembered. Let's talk about the cryptococcus. We are all in the era of HIV. We need to know everything about Indian ink up to the level of what is the treatment of choice for cryptococcus and how do you evaluate. Now, in the mycology there are 5 organisms which you have revised, doctor. Candida albicans, histoplasmosis, and the blastomycosis. They are the 3 important things, and all those dermatophyte infections associated with the skin and dermatology. One question is going to come out of them. Now let us talk about this. Blastomycosis, B is for B, that is a broad based unipolar budding yeast is basically the blastomycosis is what need to be remembered. Whereas cryptococcus is an encapsulated yeast. It produces the round budding cells. There are no true hyphae. Pseudohyphae are usually absent and very rudimentary in nature. That's the reason, doctor, mycelium has a narrow base is a true statement, polysaccharide capsule is true, it reproduces by budding, but pseudohyphae is not really a feature, it is only rarely seen or never seen is a true statement. So what you can see here is from the mother cell, when the daughter cell is basically budding, the base is basically very narrow. So this is the daughter cell, this is the mother cell, from it while it is budding it is very narrow. So narrow based budding is seen in the case of the cryptococcus. Broad based budding is seen in the case of blastomycosis is going to be the carry home message. Because of the capsule, you can do a muciramine staining positivity is one of the important and classical features. Let's go to the next question. Through blood transfusion, what is transmitted, doctor? All of them are basically transmitted. Now let us talk about Clostridium. What are all the conditions that are caused by Clostridium? Clostridium has got one gas gangrene group. That is the Clostridium perfringens and Clostridium noviae and septicum. And food poisoning group, out of which Clostridium perfringens type A causes gastroenteritis, type C causes the necrotizing enteritis is what need to be remembered, and acute colitis following antibiotic usage is caused by the difficile, and botulism is caused by the Clostridium botulinum. Now I will give you one similar MCQ which you have to answer, doctor. Clostridium tetani, you try to give all these statements regarding it. Do you think it is a gram-positive coccus? It is not a coccus, it is a rod. That's good. Is it found in soil and human feces? Very much found. Does it secrete exo or endotoxin? Exotoxin. And do you think spores are destroyed by boiling for 1 hour? Think and tell. So spores are destroyed only by autoclaving, not boiling. So everything about Clostridium you need to know, doctor. Now I'll give you one more similar question. Regarding the tetanus, either in microbiology or in SPM, one question is going to come. Regarding clinical feature, what is the incubation period, doctor? What do you mean by incubation period in tetanus? Do you think it is a time from the injury to the first spasm? It is not incubation period. And it can be as long as 30 days. So, and autonomic dysfunction is common, and laryngospasm can occur, but incubation period definition is wrong in this particular options given to you is what need to be remembered. And one more similar question I'll give you in tetanus once more. Do you think involvement of the cranial nerves has got a better or a bad prognosis? It has got a bad prognosis. Neonatal tetanus has got a lower or a higher mortality? Higher mortality, no doubt about it. In exam such option is there, don't think why is this option given, probably there must be a lower mortality only, that is the reason he is checking me. He is thinking that I will think that the babies will have higher mortality, why will I think like that? So all these auditory hallucinations when they occur in exam, no, stop them and think, is there any valid reason, at least once did I read physically somewhere or did I see a patient who has got a better prognosis and better mortality? And so that's the reason, doctor, sometimes what happens is all those hallucinations, delusions should be overcome in the exam. Now that's the reason I am giving you a small what you call send-up preparation before the battle. Catecholamines are typically elevated, and neonatal disease commonly arises from the umbilicus, as all of you know very well. One more similar question I will give you regarding management of tetanus. Until your exam you need not revise this topic. So muscle relaxants, do you think is a part of the treatment, doctor? It is not a part of the treatment. Never we have given like that, right? Anywhere succinylcholine is given, any such concept is not there. Good. So tetanus immunoglobulin is recommended, and IV but not the oral metronidazole is the treatment of choice, drug of choice, and infection does not confer the immunity, and vaccination is still required. Though I was recently infected with tetanus, I was ventilated, I was brought out, then next time throughout my life tetanus is not my friend. It can succumb me once more. So there is a reason you need to be clear about. Infection does not confer the immunity is a golden rule that you should basically remember. Surgical debridement need to be proceeded as soon as possible is the golden rule. Now can you tell me which organism among the Clostridium species that you are seeing here, doctor? Take up the challenge. Do you think botulinum or difficile? It is the Clostridium botulinum spores is what need to be remembered.